Hello, my name is Zach Jenkins. I'm an associate professor of pharmacy practice and a clinical specialist in infectious diseases. If you've been following the news this past week, you may have actually seen some reports come out about a mysterious illness being tied to children with COVID-19. It's left a lot of parents out there to wonder, is this something we should be concerned about? Now, I'm a father of two, and when I see these kinds of reports come out, it always gives me pause to say, what should I do? Based on what I know about the evidence, is this something I need to take action on? So my goal today is to really describe what we know about this illness, what we don't know about this illness, and where possible to quell any fears that I can. So the reports about this disease actually didn't really initiate this past week. About 3 weeks ago, there were some initial case reports coming out of the United Kingdom. And in the United Kingdom, they had actually tied this mysterious presentation of these children. They actually saw this and they tied it to COVID-19. It would seem to be only in those positive patients. And what was interesting to note is it didn't necessarily happen while someone was actively infected, but it actually, they think, was triggered by the inflammatory response. It could occur later on, almost a delayed response. And what's interesting about how these patients are presenting is it looks a lot like a disease called Kawasaki's disease. And actually, in the reports that have been coming out, people have been calling it Kawasaki's disease, including myself, based on what I was seeing. We're going to get into how there's actually some subtle differences, but what I want to talk about is some of the data we saw here in the United States. So on April 30th, a report came out talking about some of these symptoms that they were seeing in pediatric patients that they likened to Kawasaki's disease. What's important to note, though, is that the United Kingdom's Kawasaki Disease Foundation actually did release a statement describing how there's not really any evidence of people being at an increased risk of COVID-19 infection if they've had Kawasaki disease, and likewise, they don't know if COVID-19 would potentially put people at a higher risk for Kawasaki disease in the future. So that's something that's kind of an important qualifying statement to get into. So what is Kawasaki's disease? How do our patients typically present that have it? Well, Kawasaki's disease is a disease that was identified back in the 1960s in Japan, and they think that it only occurs in patients who maybe have had some kind of bacterial or viral infection. They've actually thought it's viral infections. What they don't know is what viruses cause it or really how it happens. So that's been a mystery all this time. How these patients present, though, is it's an inflammatory illness. So they come in with high fevers. Sounds a lot like COVID-19 so far. Sometimes they'll have irritated throats, mouths, and lips, red and pinkish eyes, and swollen glands. And all those things are less specific symptoms. Other things can cause them, like strep throat and things. What is more specific to Kawasaki's disease are some other odd signs and symptoms. So they have something called a strawberry tongue. And that's where there's a really inflamed and red tongue. And I'll show you an image of it here in just a moment. They can have really significant rashes all over their body, particularly on the chest and the legs, and sometimes in the groinal area, and then peeling skin, almost like they've been sunburnt. They also will sometimes have swelling and redness of hands and feet, almost like hand, foot, and mouth disease. So these are things that are very specific to Kawasaki's disease, a little bit more specific than what you might see with other kinds of respiratory infections that you're very familiar with. So when we mention strawberry tongue, here's actually what it looks like. If you just look at the tongue, like it sounds, it looks like a strawberry. You have these redness that you see all related to inflammation, and these bumps that pop up all over. So it's kind of unique to this typical illness. But what we're starting to see reports of is we're seeing the same thing in some of these patients who've had COVID-19 and have this inflammatory syndrome occur afterwards. So the same article that I mentioned later goes on to say that these rashes could represent COVID-19 involvement of, they think, blood vessels. And one thing we've actually seen in Kawasaki disease is an inflammation of blood vessels. And so that's really interesting. We're going to get into why that's interesting here in a moment, but I kind of want to bring this to everyone's attention. There's been some confusion, I think, around, well, how does our inflammatory system work? Don't we want inflammation to occur to actually kill off viruses? The answer is yes. The goal of any bug is to spread, and the goal of your immune system's response is to stop the spread of whatever bug that we're dealing with. And so you kind of have a balancing equation that really occurs. What's important to note, though, is that sometimes these organisms are really smart and they can tip that scale. And in doing so, they actually want the immune response to occur, because things happen like the bug can move more freely in fluid throughout the body. Sometimes it's easier for the bug to infect things when there's actually more inflammation that occurs for other reasons as well. So sometimes this is something they're doing intentionally. Why this is kind of important. We talked a little bit about this last week when we went into some emerging theories. we know that COVID-19 can cause a cytokine storm. So you have all these inflammatory markers that go around and they cause lots and lots of inflammation, which ultimately leads to the creation of these reactive particles in a blood vessel. Reactive particles are something that basically can cause damage to a blood vessel, and that's really important to take note of. We also know that COVID-19 to enter a cell typically is going to bind to the same area that another enzyme called ACE2 binds. And why that's really important is ACE2 produces a substance that gets rid of a lot of these reactive particles I mentioned. So because we're creating more things and we're actually reducing the ability to fight those reactive particles off, we have these particles that accumulate, and we think they're accumulating in blood vessels in some of these cases. When that happens, you can cause severe inflammation and damage to the lining of a blood vessel. Now, this is something we thought that's occurring in COVID-19. We think it could be causing clots. But what's interesting is in Kawasaki disease, we also see a lot of inflammation of blood vessels, and that causes some significant disease. And so maybe there's some kind of link between the two of these things. So on the 14th of May, the CDC ended up they ended up releasing a statement talking about what they called Multisystem Inflammatory Syndrome in children, or MISC for short. And this is something that's describing that presentation, that inflammatory presentation that I mentioned. So they sent this out to medical professionals so we could start to work to identify it. And what they did is they described a case definition of what this MISC illness might actually look like in patients. So really quick, let's talk about what a case definition is and why we're kind of employing in these cases. So when we see any kind of illness related to an infection, people present with a syndrome. And a syndrome is really a collection of symptoms associated with that illness. And so in this case, what we're talking about is a syndrome, a collection of symptoms related to COVID-19 infection, specifically in a smaller population, in this case, children. So we have these case definitions that epidemiologists work to put out because it allows us to start to collect data to see how often are we seeing these groupings of symptoms in patients. So as we have any outbreak, these definitions pop up. And so from a medical professional point of view, what the CDC has told us is essentially these are the things we should be looking for in our patients. And they make a statement down here at the bottom that some individuals may look like they have Kawasaki disease. They may have that kind of diagnosis based on how they present, but you should still report them just in case. And then what that lets the public health authorities do is kind of sort out, is it Kawasaki's or is it this MISC illness that we're starting to see? What's interesting about MISC compared to Kawasaki disease is there are a few things that are a little bit more unique about it. One of which is you have a low number of lymphocytes that are present, whereas in Kawasaki disease you have a high number of lymphocytes. Lymphocytes are a kind of white blood cell, and we see them present oftentimes in viral infections. And so it's just interesting to note we're not seeing that elevated in these cases related to COVID-19. In contrast to Kawasaki disease, people that come in with this MISC illness, children that come in with MISC, tend to actually look like they're in shock. So their organs are shutting down. They're not getting good blood supply all over the place. And they also will sometimes present with a lot of abdominal pain, which you don't see in Kawasaki disease. So these are things that are a little bit more unique to MISC. So there was a statement that the CDC also released specifically targeted at pediatric health providers. And they went on to say that MISC, they've actually found based on some of these case reports, can occur weeks after a child has actually been infected with COVID-19. So after they've had SARS-CoV-2 infect them, that's when they could present a little bit later on. And they think that maybe it's a delayed inflammatory response to COVID-19, but we don't know for sure. They also go on to say that they're still actively working to better understand this new syndrome, this new group of symptoms, including how common it is and what kind of risk factors cause people to present with it. And they're trying to track these cases independently. So let's take a step back from that because it sounds kind of scary that people can present with all of these problems. It's important to note that to date, the rates of infection for children with COVID-19 have been pretty low, largely because we've had a lot of social distancing at play. But also, when children have had it, we've also noted that it's not quite as severe, and I'll give you some stats to kind of back that up here in a second. But 2% of confirmed cases in the United States to date were just in children under the age of 18. So that's a very small number. The other thing to take note of is how severe is this in children when we have it. So what we've seen to date is in our pediatric patients, about 15% of them are infants, so not a large number. So as a father of someone less than 1 year of age, that gives me some measure of comfort. We also know that children typically have lower hospitalization rates based on the data we've seen. And we know hospitalization typically is seen about 20% in adults. Most reports are kind of indicating that maybe it's lower, so maybe it's like somewhere between 6 and 10%. So that's just something that's important to note. We also know that when people are hospitalized, when children are hospitalized, it's most common among the very young, but also people that have more of those chronic conditions. So children with chronic lung conditions like asthma, significant cardiovascular illnesses, etc. What's even more important to note and very encouraging to take note of is that there have been even though with all those hospitalizations, there's been a very, very low number of ICU-related admissions. And those have been under 1% in some reports, up to a maximum of 2%, where we know it's closer to 5% or even a little bit higher in adults. So what that tells us is that majority of these cases are going to be mild. And so as a parent, that gives me comfort, and I hope it gives parents out there some comfort as well. So what are our takeaways as parents? We have this syndrome that's being described. And so what we should be looking for in our children is if we start to see abnormalities in our children where there's a lot of abdominal pain, there's neck pain, vomiting, diarrhea, they have unusual rashes that weren't there before, and they're very tired. And then when we start to see all of this swelling and maybe that strawberry tongue that we talked about earlier, if you see those kinds of things as a parent, you should absolutely contact a pediatrician or some other medical authority. In those cases, we can take the child in, they can then get evaluated to see whether or not this is indeed MISC. But by and large, my takeaway for you is that this is very rare. Even so, we don't know everything about it, and we're doing our best to identify these cases more and more so we can address them to a better degree in the future. Thank you all.